Good afternoon, everyone. We are thrilled to welcome you all to another exciting and inspirational episode of Concorde Conversations. This is an initiative by Concorde Medical Group to educate, empower, and encourage our community about our health so we can all live to our fullest potential. Today, we're celebrating Heart Month and Go Red for Women with our discussion, Heart to Heart, about women's heart health. We're so excited for you to be here with us. Hi, I'm Dr. Catherine Weinberg, Director of the Adult Congenital Heart Disease Program, and I'm joined today by two fabulous colleagues, both board certified in cardiology. Our amazing returning guest, Dr. Lauren Rosenberg, and introducing Dr. Andrea Berger. Many of you have already sent in excellent questions, which we will be discussing today. We only have 30 minutes together, so we will try to go through as many as we can. Remember, we are giving general guidance. If you have a particular question about your health, we want to help you. So come in and talk to one of our amazing physicians so we can answer your questions and give your health the attention it deserves. Let's begin. Okay, Dr. Rosenberg, how common is heart disease in women?
So heart disease is extremely common in women. It is the most common cause of death for women, the #1 killer of women, more so than cancer or any other cause. And that's across the world, not just in the United States.
All right, Dr. Berger, what are the most common symptoms of heart attacks in women, and do they differ from men's?
Before I discuss the differences between the symptoms of men and women when they're having a heart attack, I'm going to say some general statements which apply to both sexes. Many people do not have the classic Hollywood presentation of a heart attack, which is an elephant sitting on their chest or a fist in their chest. Many people have more mild symptoms or even no symptoms at all, called a silent heart attack. Usually chest pain is a cardinal feature. And chest pain tends to be with physical activity or exertion. That's one of the differences that distinguishes chest pain from your heart from other forms of chest pain. But we certainly do not want you diagnosing yourself. We want you to come in. Shortness of breath is also an extremely common symptom. Shortness of breath results when the heart is not functioning normally, when it's not getting enough oxygen, so the heart is not functioning properly. The blood backs up into the lungs and can cause shortness of breath. Women are much more likely to have what's called atypical symptoms, as I'm sure many of you know. There's been a very aggressive campaign to increase the way women present with heart attacks, although still we find women especially, not being taken seriously when they present with a heart attack. But women are more likely to have atypical symptoms. In fact, 45% of women who have their first heart attack do not have chest pain at all. They may have pain elsewhere, in their jaw, in their neck, in their teeth, in their back, shoulder. Or they may have no pain at all. They may only have shortness of breath or profound fatigue or inability to do their regular exercise routine. Sweating, nausea, and clamminess are also common in both symptoms. What we want you to know is if you're experiencing any of these symptoms, call 911 or go to an emergency room immediately. Time is heart muscle, and you should not wait.
Right. I'll just add to that, women tend to wait longer before presenting to the hospital. I think that's probably a combination of, one, the impression that women don't suffer from heart disease the same way that men do. And also, like Dr. Berger described, they more often have atypical symptoms.
Mm-hmm. So if you have symptoms, get treatment, right? Okay, Dr. Rosenberg, the American Heart Association want women to know their numbers. What numbers do we need to know?
Right. So I think obviously these numbers are related to your risk for heart disease. So the risk for heart disease comes from your blood sugar, your blood pressure, your weight, and your cholesterol. So those are the numbers that you need to know and need to be evaluated so that you can prevent heart disease.
Great. So Dr. Berger, what is high blood pressure?
High blood pressure is a very important risk factor for the development of heart disease. It can directly damage and harm your heart arteries. Frequently, people come to our office with high blood pressure. This is constantly a moving target of how aggressive we should be with control of high blood pressure. But the current state of the art is that an ideal blood pressure, your optimal blood pressure, is less than 120 on top and 80 on the bottom. High blood pressure is defined as a blood pressure either greater than 130 on the top or 80 on the bottom. Now, if you have this level of blood pressure, you should certainly come in and talk to one of us, and we can help you discuss whether lifestyle modifications such as salt restriction, increasing your physical activity, losing weight, and moderating your consumption of alcohol, which a lot of people don't realize is a risk, can worsen your blood pressure control, or whether you have an underlying condition such as diabetes or kidney disease, which makes a medication warranted at an earlier time.
Mhm. All right, Dr. Rosenberg, should we all be seeing a cardiologist on a yearly basis? We have everyone go for mammograms and pap smears on a regular basis, but should we be doing the same thing with our cardiac health, especially if you have risk factors such as the family history?
Right. So I think if you have risk factors, it's certainly a good idea to check in with a cardiologist. Until the last few years, the way that we determined, what your risk of heart attack and stroke was is we took your cholesterol, high blood pressure, plugged it into a calculator with your age, and it spit out a number. That number does not take family history into consideration. And really, family history is the thing. So if you have a strong family history, especially if a parent or a sibling had a heart attack or stroke at a relatively young age, that would certainly be something to see a cardiologist for before you have any kind of symptom.
Oh, I just wanted to say one other thing about family history.
Mm-hmm.
So the definition of premature or early heart disease is in a first degree relative. So usually brothers, sisters, parents are the most important. Frequently, we also have, people reporting heart disease in a maternal or a paternal grandparent. But what we're really looking at is we define young as women having heart disease, blockages of the arteries or a heart attack, younger than 65 in women and younger than 55 in men. And I also wanted to say that genetic factors are very important as well for the development of high blood pressure and high cholesterol.
All right, great. So let's talk a little bit more about risk factors. What are the risk factors in women for heart disease, and how do they differ between men and women?
So women tend to develop heart disease at an older age. In that way, we have an advantage. But there are some other things that, would predispose you to heart disease in a way that men don't experience. So one would be if you had high blood pressure during your pregnancy, particularly if you had a condition called preeclampsia. The other condition, especially during pregnancy, is gestational diabetes. That puts you at risk for future diabetes, and it also puts you at risk for heart disease, as you get older. There's also a particular time when women start to develop a higher risk of heart disease, and that is in the perimenopausal period. So as women enter this phase of life, the rate of heart attack and stroke certainly starts to rise, and that period of time is a sort of a higher risk time in general.
Got it. All right, Dr. Berger, can stress cause heart disease?
I think this is a very important question, especially given the last 2 years where we've all been under the most stress involved in our lifetimes, and our last 2 years have essentially been 10 years. But anyway, an isolated stressful event, such as a death of a loved one or a heated argument, can certainly precipitate your chance of having an adverse heart effect, which is either a heart attack or a serious heart rhythm problem. Stress can cause a fight or flight response. It can cause your hormones to cause physiologic changes in your body, increasing your heart rate, increasing your blood pressure, can also even cause spasm of your heart arteries. But these can lead to both a heart attack and also dangerous life-threatening heart rhythm problems. In addition, more everyday stressors that we have can also affect our overall heart health. When we're stressed, we're less likely to take care of ourselves. We're less likely to have healthy lifestyles. We're less likely to eat right, exercise, sleep well, do all the things that we know is good for our heart. And all of these poor lifestyle factors do adversely affect our inflammatory response, which we know is a very important risk factor for the development of heart disease. So laughter should also be a part of the armamentarium.
All right, Dr. Rosenberg, what are ways we can reduce stress?
Right. So I think, like Dr. Berger mentioned, when we're stressed, we don't sleep well. You can almost feel the hormonal changes when you're stressed, and those chronic hormonal changes certainly do have an effect on, your heart muscle and your heart arteries. So I think it's really important to try to break that cycle of stress. So number one, getting adequate sleep is super important. And I think study after study just shows, increasingly how important getting a good night's sleep is. The other things are exercise. Exercise has been shown to improve mood, improve sleep quality, and just decrease overall stress. So that's really important. Also, meditation has been shown to decrease stress and improve outcomes for people, and prevent cardiac events. So I think, getting into a good habit of daily exercise, meditation, and good sleep are probably the most important things to reduce stress.
Right, great. So a lot of people use smoking as a stress reliever. What do you think about that, Dr. Berger? If you quit smoking, does my risk of heart disease decrease? And how long does it take for it to decrease?
Smoking is not a good way to decrease your cardiovascular risk. I think most of us know that. In fact, quitting smoking is probably the number one thing you can do if you are smoking to improve your overall heart health. And the good news is it starts almost immediately when you quit smoking. Days to weeks after you quit smoking, you already have improvement in your arteries. The smoking directly negatively damages your arteries, causes them not to function so well, accelerates blood pressure, accelerates atherosclerosis directly. Your risk of heart disease decreases by about 50% after the first year after you quit smoking. And the risk continues to decrease with both respect to smoking and lung cancer with each additional year that you are free of smoking. So we would love, again, for you to come in and talk to us about ways to improve your success in quitting smoking. We also have a lot of lung doctors who can help. We're here to help. It's not easy.
It certainly isn't easy, but you can succeed, right? Lots of people quit smoking and do well. So, Dr. Rosenberg, why are women at a higher risk for developing heart disease during menopause and perimenopause?
Right. So, up until the time of perimenopause and menopause, women have the benefit of estrogen, which gives us some relative protection for the development of plaque in our arteries. As you go through those hormonal changes, the relative risk of heart disease starts to increase. In addition to the hormonal changes, or because of the hormonal changes, there are difference in fat distribution. We start to, instead of storing fat underneath the skin, we start to develop something called visceral fat, which is fat inside of our organs, which puts you at a particularly high risk of heart disease. And that's just one of the changes that happens around perimenopause. So from the development of perimenopause and into menopause, that's when women's risk starts to go up.
Right, great. So let's move on to testing. What is a stress test, Dr. Rosenberg, and when should you have one?
Right. So a stress test is basically a test to see if there is severe blockage in your heart arteries that when you exercise would impede the flow to the heart muscle. So it's a test meant for people who have either shortness of breath or chest pain, to see whether blockages in the heart arteries are the cause of those symptoms.
Great. Dr. Berger, what are other tests that we can use to diagnose heart disease?
One of our favorite tests in this office, because it's so outstanding and so predictive and so robust over years, is something called a coronary calcium score. It was initially created by Art Agustin, who created the South Beach diet. It's a very easy test. It's a CT scan. It lasts about 2 minutes. It takes longer to get you in the machine and get you out than to actually do it. So you're not going to have the fears of claustrophobia and things like that of being in a machine for 20 minutes. It's a relatively low amount of radiation. almost every one of my patients ends up getting it at some point because of both its power and people's desire to know. The people that come to heart doctors want to do whatever they can to know their risk and to prevent it before symptoms occur. That's what you'd like to do. Is you'd like to usually, as Dr. Rosenberg said, stress testing is usually when you come in with chest pain and shortness of breath. Calcium scores are useful before you have symptoms. They can diagnose heart disease. You can start controlling your risk factors and stratifying your risk before you have symptoms. The calcium score gives you a numerical score between 0 and now I keep changing my higher number, but I've seen as high as 3,000. So 3,000 it's a numerical score. They give you a percentile as for your age of where you should be. People who are lower risk tend to get calcium scores because they're more interested in prevention rather than if someone has rip-roaring chest pain, they may go for a heart catheterization or a more aggressive test rather than a preventive test, just to give people an idea of what blockages of the heart really look like. Let's see if I can coordinate enough to do this. So this is a heart artery this way. Okay, it's cut like a loaf of bread in certain sections. Your ideal is a 0, which is a perfect score. There is no what I call yellow schmutz in there, which is a very scientific term. But so you see that there's good flow through this artery. There's not a lot of junk in there. So this is what you want. Unlike in tennis, you don't want a 0, you want a 0 here. The next one is mild. You see how there's a tiny bit of yellow in there. You still have good flow. This is a score of around 50 to 100. The next one is more moderate disease, probably a score of around 300. And the next one is around 1,000 or over 1,000. So you see here that blood flow, there's definitely an impedance to blood flow. And what we really care about is the good old muscle. We care about heart flow to the muscle. So when you have decreased heart flow to the muscle, that's where you get into trouble. If we were to do a stress test on you, like Dr. Rosenberg said, a stress test would only be abnormal here. It would not be abnormal in these 3 settings. So if you're here, you have the luxury of not eating butter, cream, cheese, and fat and red meat. Here, you're probably looking at a cholesterol medication. So this test is extremely useful. Let me just say one more thing. It's not covered by insurance. It's $99. It's the best $99 you'll ever spend.
All right, Dr. Rosenberg, what is a statin?
So a statin is a cholesterol lowering medication. And as we already discussed, having elevated cholesterol is a really important risk factor for heart attack and stroke. So statins decrease your cholesterol. And the reason we care about that is because study after study shows that being on a statin reduces both your first heart attack if you have risk factors, and if you've already had a heart attack or stroke, it reduces your chance of having another heart attack and stroke. So it's a really important medication for treatment for people both with risk factors and for people who already have plaque buildup or heart attacks.
Okay, what do you think about red yeast rice and other supplements instead of using statins?
When you use a supplement, the problem with it is that there is absolutely no oversight in what is in that supplement. So the FDA does not regulate supplements at all. When you take a supplement, nobody has tested it to see what is in it. So I think it's really, if you have a risk factor, and we also don't have any data for them. So we certainly have a ton of data for statin. We know what's in it. So, given the choice, 100 times out of 100, you should choose the statin.
All right, great. So there's a lot of questions about aspirin and when we should use aspirin. Dr. Berger, when do you recommend aspirin for heart disease?
There's no question that if you have established heart disease, you've had a previous heart attack, or if you have an extremely strong risk factor like diabetes, that you should be on a baby aspirin. There is no question or controversy about that. Diabetes is such a strong risk factor that it's almost considered equivalent of having a prior heart attack or heart disease. Where the recent controversy has come in is when you're using baby aspirin to prevent heart disease. You may only have mild risk factors, a little bit of high blood pressure, a little bit of cholesterol. That's not as clear whether when you weigh the individual risks and benefits of aspirin. Aspirin is not harmless. A lot of people think a baby aspirin is harmless. It's not harmless. If you were to fall, you could have a serious complication. So you have to weigh your individual risk and benefits of aspirin Please come in and talk to us if you have any question, whether you should be on an aspirin, and please don't stop your aspirin based on something you hear on the news without talking to your cardiologist.
Yes. So, Dr. Berger, what is heart failure?
Congestive heart failure is a syndrome. It's a clinical syndrome where the heart is not adequately pumping blood to the rest of the organs. So you get evidence of end organ, what we call about end organ damage, or organs not getting enough oxygen. This can be either due, and consequently, blood flow will back up. If the heart is not functioning properly, blood can back up into your lungs. That's why you get shortness of breath. It can back up into your legs. That's why you get elephant trunks in your legs. It can back up into your belly and also into your neck. The first test to evaluate heart failure is something called an echocardiogram, which I'm sure a lot of people that have come to the office get. It's one of our standard tests. It looks at both the function of the heart and the valves. That's one of the most important initial diagnostic tests. And then with regard to therapy, it is both medications and diuretic therapy. Controlling blood volume is one of the mainstays. But it's a complicated topic, but if you have it, we have experts. In fact, I did an additional heart failure transplant fellowship in heart failure, but we all have excellent experience dealing with heart failure.
Okay, Dr. Rosenberg, how does heart failure differ in men versus women?
Right. So again, women tend to develop heart failure at an older age than men do. And they tend to have a filling problem rather than a pumping problem. And usually, or more commonly in women, it is from long-standing high blood pressure. So again, another reason to kind of control the risk factors and control the blood pressure before it becomes a problem.
Great. So there is a question in the chat box. Should you give a baby aspirin to someone who is having a heart attack before the ambulance gets there? How do you know they're having that heart attack?
If you believe someone is having a heart attack, I think, it's perfectly appropriate as the ambulance is coming is to chew an aspirin. That's what we would do once they arrive to the emergency room. So chew a full dose aspirin, and then you would just let the ambulance know that that's what you've done.
Okay, great. Let's see. So, there's another question. If someone is under strict blood pressure management and has consistent chest pain or pressure, can it be an indication of a possible heart attack, Dr. Berger?
So, chest pain obviously has many causes. High blood pressure is only one of them. So if your blood pressure is controlled, your chest pain is not due to high blood pressure, because if your blood pressure is controlled, you're not going to have chest pain from it. So that's, at that point, you need to look at other causes like blockages of the arteries or inflammation of the heart muscle or blood clot in the lungs or other causes of chest pain, muscular, anxiety, all those things. There are many causes of chest pain, and high blood pressure is only one.
All right, Dr. Rosenberg, what can I do to reduce my risk of heart disease?
So one of the things I always tell my patients is that, it's really important, no matter what you've done in your past, to change your eating habits, eat a super healthy diet. I generally recommend a green Mediterranean diet, which is essentially a plant-based diet with some lean protein, and also making sure you get daily exercise. I think it's really important to build up a pattern of exercise, and doing it every day will help you build the habit.
Great. Okay, Dr. Berger, if you had one action step to recommend to our viewers to improve their health and start today, what would it be?
I would say knowing your numbers. We've already talked about that before, but knowing what your cholesterol is, knowing what your blood pressure is, knowing what your weight is, knowing what your sugar is, knowing if you have prediabetes. I know a lot of people have not seen a doctor in over 2 years because of fears of the pandemic. Now is the time. Spring is coming, optimism in the air. Knowledge is power. Denial is not good. A lot of times the people that come to see us are the people that don't need to come to see us, and the people that need to see us are sitting. So please come in, please address your current state, and we'll help you think of ways to improve it.
Okay, Dr. Rosenberg, what's your response?
Well, I think I just said it. I would recommend daily exercise. Our AHA, which is our the cardiology professional organization, recommends 120 to 150 minutes of exercise a week. So that would be my action step: daily exercise.
Well, that sounds like a great plan. So, thank you all for joining us for another inspirational and educational episode of Concorde Conversations. Please fill out the survey and let us know how we're doing and how we can serve your needs better. We know many of you have additional questions and we'd like to help you. So, come in to speak with one of our amazing physicians about your health. We care about you. Happy Heart Month, everyone. And thank you so much for joining us for another episode. Bye.